Chiropractic care is a licensed healthcare profession that focuses on the human body's ability to heal itself. This involves a chiropractor's manual adjustment of a patient using a variety of techniques. Oftentimes, a chiropractor will get a patient in and out of their office within a matter of minutes. However, as our guest tonight will tell you, spending quality time with each and every patient during one visit can lower the amount of trips you may have to make to the chiropractor overall. Chiropractic care, that's our topic today on Doctors on Call with our guest, Dr. Lindsay Gallion.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from CAMCO, the state's only Kansas-based medical liability provider, serving medical professionals and advocating for the health for all Kansans.
Russell Regional Hospital, experts, neighbors, friends.
Your family is our family. Staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in North Central Kansas.
Degree in kinesiology from Kansas State University. She earned her doctorate from Cleveland Chiropractic College, graduating with honors. During her time at Cleveland, Dr. Mellon spent much of her time in postgraduate seminars for active release technique, Graston technique, motion palpation, activator technique, kinesiotaping, and sports injury rehabilitation. Prior to Russell Chiropractic and Sports Therapy, she served at KC Core and at a private practice in downtown Kansas City. Her clinical focus is on the treatment of soft tissue injuries through myofascial release, improving body biomechanics, and correcting muscle imbalance. Give us a call at 800-337-4788 toll-free with your medical questions about chiropractic care and sports therapy today on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician or chiropractor. Thank you so much, Dr. Mellon, for coming and visiting us again on Doctors on Call. Let's go ahead and get started with some questions.
All right.
First of all, why should a person choose chiropractic care?
Chiropractic care is a great alternative option for general pain management. It's been proven to be a good option for sports injury as well, and it's very low risk.
Okay, and when we say chiropractic care and sports therapy, let's talk about the sports therapy side.
Okay, sports therapy is kind of an all-encompassing term that we use to kind of roll in some physical therapy aspects. It's not true physical therapy, but it's therapeutic exercise, it's the myofascial work that we do, it's dry needling, and it's a better return to sport.
And do you sometimes tell your patients to refer them on to physical therapy?
Oh, for sure, yes. There's many times that I will co-treat with physical therapists. We'll be seeing them both at the same time. When they're seeing a physical therapist at the same time they see me, they often see the physical therapist more like 3 times a week, and they'll see me maybe 1 or 2 times, or one time a week or every other week during that time, because I'm kind of working on reducing the muscular tension and they're working on stabilization and improving range of motion.
And do you find that working together you have greater results?
Oftentimes, yes. Mm-hmm.
Absolutely. Okay, how does a person go about selecting a doctor of chiropractic?
Pretty much just like how you would look for an orthopedic surgeon. First, you kind of want to assess your needs as the patient. So what you're looking for should drive which physician you choose. So if you're a mom and you need a chiropractor for your child, you should look for a chiropractor who has a pediatric specialty. If you're looking for more of a sports injury therapy, you should look for a chiropractor who specializes in that. It is not taught to all chiropractic students. I mean, you have to kind of seek out that part of being a chiropractor. So if that's what you're looking for and you just pick a general chiropractor, you may not be getting what you want. Or if you're looking for dry needling specifically, you'll need to look for that. Also, if you're looking for network status, you can search for that. But really, I think the best place to start is assessing what you need as the patient.
We spoke a little bit in the open about a lot of times you go into a chiropractor, you're there for a couple minutes and off you go. How do you differ from that?
I at least spend 20 minutes, at least 15 minutes a session with a patient, and oftentimes 20 or 30. The main reason for that is I'm pretty heavy on the manual therapy. I do a lot of muscle manipulation before we adjust, and a lot of pre and post testing to see if the treatment is appropriate for the patient. So that just does take time, because in the evaluation we want to make sure that the intervention is appropriate. Also, a lot of the times we want to do goal setting. So if you're in a middle of your treatment plan, we need to assess if we're on the right track. And if we're not, we need to change or we need to refer. So a lot of times a longer appointment like that encompasses a little bit more discussion and a little bit more pre and post testing for the patient.
Sure. You mentioned muscle manipulation. What is that?
We do several types of muscle manipulation in our office. Dry needling is probably the primary. Graston is another one. Active release is another one. So it's basically just taking a tool. Sometimes it's my thumb, sometimes it's a needle, sometimes it's a metal tool, to manipulate muscle that is restricting motion or that has lower function.
And if you don't do the muscle manipulation and you just, do
An adjustment.
an adjustment, how does that differ?
Yeah, we kind of call that cold adjusting. For one, I feel like it's more painful for the patient, and if you don't do the muscle manipulation, I feel like your adjustments don't hold as well, because a lot of times when you have a fixation that recurs, it's because there's a muscle holding that fixation. So the best way to do that, make the adjustment more comfortable and make it last longer, is to manipulate the surrounding muscle tissue. Oftentimes that's also accompanied by a weak muscle in a surrounding area or an opposing area. So following the adjustment, you want to make sure you do a rehabilitative exercise to get that correction improved even further.
And how did you come to doing this technique?
That goes way back to my undergrad. I would say I have a bachelor's in kinesiology, so that's basically the study of human movement. In my undergrad studies, I did a lot of biomechanic classes and a lot of exercise physiology classes, and I really kind of gravitated towards that side of chiropractic. Muscle structure, function, in accordance with the joint. I feel like it just makes sense. Your muscles move the joint, and then the joint houses the nerves. So you really kind of need to hit it all to get proper treatment.
Okay. When a patient comes in for an initial appointment with you, what will they experience?
Initial appointment with me, I always start with a very kind of lengthy exam. So it gives me your whole health history, your medication list, all that stuff, prior trauma, prior surgery, prior diagnosis, all that stuff. And then we do quite a bit of a functional exam, which includes a lot of muscle movements. So really that sets me up for your goals. So if your goal, for instance, is to throw a ball faster, we will put you in that throwing position so I can assess like the shoulder motion when you're throwing a ball. If you're a gardener, like a 6-year-old gardener, and you want to be on your knees gardening all day, we will kind of put you in that position to see what could be more optimal, maybe some ergonomics in the garden. And then that would apply to our goal setting. So if you can only be on your knees for 15 minutes, then you could say, I'd rather be on an hour without pain. So we kind of have something to work towards. So we can also check in the middle of a treatment plan where you're at on kneeling for 30 minutes, 15 minutes. If you're not any better, then we can reassess and move forward with your treatment plan. So in an initial exam, that's definitely one thing we want to focus on, is what your personal goal is as the patient in regards to pain reduction and sport performance improvement or anything like that. And then of course I treat on the first visit. So that would, as we kind of discussed, involve a little bit of muscle manipulation. So depending on what your specific complaint is, that may be Graston, it may be just active release, it may be some, percussive therapy, maybe dry needling. But that just kind of depends on what you bring into me.
You've mentioned dry needling a couple of times. Let's talk more about that, what that is.
Okay. Dry needling is a trigger point therapy technique. It's often done by physical therapists as well, chiropractors and DOs. It uses a thin filament needle, a lot like acupuncture. The difference is it's based on human anatomy and neurophysiology, more so than meridian therapy and energy flow. So basically the technique there is you want to find the tight, tender spots in the muscle tissue and then address that by inserting a needle. Those trigger points come about because there's usually a dysfunction in the muscle, and that's because there's a lower level of oxygen, which causes a contracture, and then the needle is inserted in there, and that reduces the amount of acetylcholine in that muscle.
And when anybody says needles, I'm sure some are fearful of that. Is there pain involved in dry needling?
I wouldn't say pain, but it is a little, you will feel some discomfort. It's a lot like just a needle prick. It's much less painful than getting a shot. And then you'll feel pretty much, I won't say instant relief, but you do feel better usually right when it's done. So the actual total time to do a dry needling treatment itself without the rest of the treatment is only about 10 minutes. So if it is uncomfortable, usually they forget quickly because it feels better after.
Sure.
So.
Who is a good candidate for dry needling?
That's a good question. I honestly now I do a large percentage of my patients because I've learned a lot more about it as I've studied it. And before I used it mostly for sports injury and like acute injury basically. But I figured out through studying like different ways where it works for chronic pain as well. The technique is a little different there. You find different points in the muscle, not necessarily all trigger points. And then you do a longer stimulation with them to get a little bit more of the neuromuscular response.
And you mentioned acupuncture. How does dry needling and acupuncture differ?
I would say the fundamental difference there is the theory. Acupuncture is a traditional Chinese medicine, and dry needling is a physical therapy chiropractic technique. And I mean, that's one main difference, the main difference, but dry needling typically uses fewer needles in a shorter amount of time. Acupuncture uses a lot more needles. And the points they're placed on is based on meridians and not necessarily pain or palpation at all. It's more body mapping.
Okay. Is chiropractic care covered by insurance?
Insurance coverage for chiropractic care is very dependent on practitioner network status. If the practitioner is in network, it should cover most services offered by chiropractors. Manipulation for sure. Therapeutic exercise, which is part of my treatment plans, is sometimes covered, sometimes not. Extremity adjusting typically is, and modalities can or cannot be. But for the most part, if you have insurance in the chiropractors in network, it will be accepted.
Last week, an interesting question. We had our veterinarian on, and he was discussing chiropractic in animals. Is that something that you do?
No. I stick to humans, but it is very effective. And I actually just recently watched some videos on animal chiropractic, and it's amazing what those people can do. And I know that some veterinarians can take seminars and learn it. I mean, because they already know the anatomy, and once you take the seminar, it's basically just learning the thrust.
Sure, very interesting.
Yeah.
Now, is there, on average, how often do you see a patient?
Like treatment frequency?
Right.
Yeah, okay. That would definitely, like, for sure depend on what they're bringing me. So, like, for a patient with back pain, let's say that's a normal, average, healthy person that has no pre-existing conditions, no sign of something pathologic. Honestly, an acute flare-up usually would be treated in about 2 to 4 visits. If it's something that reoccurs, or if it's something where they have an accident from work or repetitive injury, and then they go back to doing work the same every day, that will take a little bit longer. So I would say if I'm not seeing any results in 10 visits, they need to be referred on.
And is there such a thing as visiting the chiropractor too often?
Yes, I would say yes. You shouldn't. I don't think a patient should get adjusted weekly all the time. Now, that being said, I do have a lot of chiropractors do have patients that come in that often, but I don't think they should be full body manipulated each time. If you have a patient that's coming in that often, it's usually because they have multiple complaints, and you kind of spread out the manipulation. Because if you adjust the same joints that frequently, they will develop hypermobility, and that causes just as many problems.
Now, is there, out here in Western Kansas, a common condition that you often treat in your office?
I would say what brings patients into me the most frequently would be sprains, strains of the lower back, headaches, and sports injury. And with all the sports injuries, it's mostly sprain strains of the ankle, hip, shoulder. I mean, really anything that's related to sports I see a lot of, but probably the most thing that comes in is a lower back strain.
And can chiropractors help with a person with chronic pain?
Yeah, the treatment approach is a little different for chronic pain, and on almost every patient that I do treat with chronic pain, I co-treat with an MD or their primary care provider, because there's something that's making that pain chronic that's not going to be fixed with a simple adjustment. Those patients do, a lot of that's lifestyle that we work on, health, nutrition, kind of the whole wellness part, but we do co-treat chronic pain with their primary care doctor very frequently.
Does your office have anything to do with supplements?
Yeah, we offer supplements. I really don't like to promote anything that I don't personally have tried or taken, or that I think would actually provide a benefit to the individual. So that's a very individualized service that we do, and that would be based on the initial consultation.
Sure. Now, sometimes or oftentimes when a person is adjusted, you hear that popping sound. What is that popping sound?
That's actually just a cavitation of the joint. It's when the joint gets gapped and it creates a gas release in there, and that expansion is what causes that noise. It doesn't always necessarily mean that the joint is adjusted, or you don't have to hear that to get a successful adjustment always. You can get an activator adjustment that makes no sound, and it's as effective. But a lot of people want to hear it.
Right, yeah. But it doesn't necessarily mean now you're in place.
Not necessarily, yes, yeah. And you can pop your own neck or back, and then it might still feel pain. And a lot of times that is because when you self-manipulate, you are cavitating a joint that is hypermobile. That's why it is cavitating with your own motion. When you lock out a joint that needs an actual adjustment, a targeted thrust is really the only thing that could get it. So a lot of times people feel like they want to self-manipulate again and again and again because they're just popping that same joint over and over again.
How do you feel about a person self-manipulating?
They're creating hypermobility, so they're just creating a little bit more instability in that joint. Because when you feel like the need to do that, it's basically your body telling you that there's something that is wrong. You're getting a signaling from your receptors that is telling you there's something not right there, which is making you want to self-manipulate. But the reason you keep wanting to do it is because you're not getting it. So I try to get people not to do it, but people still do it.
Right,
So,
right. Now, can it provide relief, or can they actually self-manipulate them back into the right place, I guess?
sometimes, I mean, I'll be honest, I do have some like at-home tricks for patients, like if they need it, but I always make it be safe. Like I don't think a patient should rotate their own spine. That's when you get into trouble. But extension is pretty safe to do at home, and I mean, you see it all over YouTube now. You can self-manipulate with a foam roller pretty easily, but it's still not a treatment.
Sure.
So.
Gotcha. You had mentioned myofascial release. Can we talk about that a little bit and what that is?
Sure. Probably the most common form of myofascial release that we do in my office is it's active release. And the reason we do that is because when you get a massage, let's say, that's a form of myofascial release also, the patient is static, so you're not moving at all. And you really only can get into a certain point of that muscle because you're not getting the muscle to contract. You're not activating those contractile tissues. So active release is a form of myofascial release where you're actually putting pressure on a trigger point and then moving that patient through the range of motion where they're restricted. So for instance, if you are having trouble adducting your shoulder, we would put you in an abducted position, put a pressure point on the muscle that's interfering with that motion, and then move you through that motion with pressure on that point. So you get a little bit more of a release out of that because the muscle fibers are actually moving underneath pressure.
And you'll see a lot of the at-home fascia guns. Are those very effective?
Yes, I'm pro fascia gun. A lot of times if patients have them, I like them to bring it in the office with them so I can show them how to use it properly at home so they're not doing more damage. Because just that's the only thing I don't like is if they're like putting it somewhere that's causing more harm. So I'm here to help them in between visits, and that's a good thing to do. That's a form of self-care at home.
Sure. What about trigger point therapy?
Trigger point therapy is also good. There's so many things that kind of correlate with, they all kind of overlap. So trigger point therapy can be cupping is one, that's a type of trigger point therapy. You can do the needles, that's a big thing of trigger point therapy, not chiropractic related at all, but you can get trigger point injections, which is also something that I've referred for if we're not getting the job done with dry needling or with myofascial release and adjusting. But that's kind of a last resort for me as far as trigger points go.
And you mentioned cupping. You hear that a lot with massage therapists. What is cupping?
Cupping is it's a technique where you basically place cups over areas of what they call stagnant blood, and they suction air out of it, which brings the blood to the surface of the tissue. That just helps move the blood flow underneath the cup. So it's designed to help move that stagnant blood, get the hypoxic areas of the tissue to get more nutrients to it, and in theory that's supposed to help improve the range of motion of that affected area as well.
Is chiropractic treatment appropriate for children or babies?
Absolutely, yes. I see lots and lots of children. It's super beneficial for their development, especially as they're growing. You can catch a lot of things early with children, which is great. You can catch, gait pattern dysfunction, or if they're like sitting incorrectly and getting a muscular balance and dysfunction that can create spinal torsion in the future. You can also see if they're starting to get a scoliosis. You can prevent it if you catch it early a lot of times. Yeah, there's so many benefits, and they respond so quickly to treatment that they definitely don't need long, drawn-out treatment plans because they're so pliable and their body's just wanting to be in the right position.
Do you often still do the muscle work with children, or is that as necessary as it is with adults?
Lately, I do see a lot of children that are getting injured from sports-related things, and in that case, or I did have a child who fell off a monkey bar and got an acute torticollis. That would probably not do well without the muscle work. You need that to get the proper, because that's basically a tight muscle that's causing rotation in the spine. So without the muscle release, you're not going to get as good of a result of that treatment. So I do if it's necessary.
And how do you feel about children? A lot of times will go from one sport to the next, and it's just a year cycle,
Yeah.
How do you feel about that? Is there a time that they need to sit down and take a break?
Kids should still be kids.
Mm-hmm.
Yes, I do believe that. And I am kind of against the whole specialization at a young age. There's been so much research to show that multiple sports is so good for prevention of injury. It decreases repetitive strain, and you just get, especially when you add in like a running or something like that, you get more planes of motion. So that just prevents injury and overuse over time.
Do you treat pregnant women?
Yes, chiropractic's very effective for pregnant women. There's lots of chiropractic techniques that are specified for pregnant women, like Webster, and that's basically more almost a ligament release, so that would almost be categorized under myofascial work, but it can help reduce labor pain, it can help reduce pregnancy pain, pregnancy-induced sciatica. It's good for all of that, because as the baby expands, your muscles are constantly changing to that center of gravity difference, so getting constant care during pregnancy is very beneficial to pregnant moms.
We're getting close to bedtime, so how important is a good night's sleep?
Very, especially if stress is one of your triggers for your pain, migraines, or anything like that. Getting good night's sleep, drinking plenty of water, all those things kind of roll into the overall wellness.
And how much water does a person? Sometimes you're hearing everybody should be drinking a gallon a day. How much should a person drink?
That is the trend now. The actual rule of thumb is half your body weight in ounces. So if you weigh 120 pounds, you should drink 60 ounces of water. But I say that's kind of a minimum. That's kind of baseline. I'd prefer you go over that, but it's hard, especially if you're not used to drinking water.
And how important is a good pair of shoes?
For spinal health, it's important. I think changing the height is better for females. Females that walk in heels all day need to balance that out with some flat shoes. Also, flats, flip-flops. You need to balance out with a good pair of tennis shoes, and going barefoot is essential.
Okay, we hear that, the grounding.
Mm-hmm.
Do you know anything about that?
Yeah, I think that's great for lots of things. If you, how do you get into that? But for just everything and healing and being one with everything. So I think that it's important, especially going back to the kids, it's good for foot development. So a lot of times the kids, because it's just, one of the doctors that I follow calls them sensory deprivation chambers, shoes, because that's how you, sense the ground. So if you're in shoes all day, it's hard to, get your proprioception.
All right.
So especially with kids and they're developing arches, they need to be without shoes.
Excellent. Very good advice. Thank
Yeah.
you so much for joining us. That's Dr. Lindsay Metlin with Chiropractic Care tonight on Doctors on Call. On our next show, we'll be discussing pain management with Dr. Bell from Great Bend. You can email questions to us for our next program at doctors@shptv.org. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from CAMGO, the state's only Kansas-based medical liability provider, serving medical professionals and advocating for the health for all Kansans.
Russell Regional Hospital. Experts, neighbors, friends.
Your family is our family. Staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.